I started back a long time ago working as a physician. I worked in the Bronx during the crack epidemic and AIDS epidemic when they were first starting. There wasn't even a name for AIDS when I started. And I became very interested in working with communities and working with people who had less than I did. Gradually, over time, I also realized that something that I personally really enjoyed was working and going to the environment, particularly the natural environment. But because my training was around epidemiology and disease, and which we call health, but we're really talking about disease, I became very interested in all the things that the natural environment, that the environment in general can do to your health, and how it's a huge risk and how it can hurt you. So I looked at things like pesticides and chemicals in food, mercury. And then gradually, because I was at a medical school that also had a marine school in the same university, I became really interested in the risks from the ocean environment. And I loved it. Having said that, I also had conversations with policymakers in particular who would say, every time I see you coming, I know you're going to tell me something else I can't do or eat or think or breathe, and all you tell me is terrible things about the natural environment. And then I had this incredible opportunity to come to Europe, to England, and start this Center of Environment and Human Health with Mike DePlege and all my colleagues here at the University of Exeter. And so over the last couple of years, we've developed this very interdisciplinary group of researchers who want to look not just at the risks, but the benefits, the opportunities from interacting with natural environments. So the idea that there could be scientific evidence for the fact that this could be something positive really, for me, was transformative. It made me see that I could sort of flip my prior science on its head. It doesn't mean you ignore the risks. You have to be informed about them. But for me, it also was a way of possibly convincing people that if they believe the natural environment is good for them, maybe they'll take care of it better. To me, the big challenge is bringing the area of public health and medical health and prevention together with environmental science, marine science, and also bringing with it stakeholders like policymakers, small and large businesses, NGOs, government, and try and get all those communities together and say, around the oceans and human health, this is good for our human health and well-being now and in the future. And if we can translate this into a better interaction with natural environments so that we don't destroy those natural environments and we realize that our health depends on the health of those natural environments, then it's a better future for our children and generations to come.